Hi, I'm Dr. Homayoun Sasson, a board-certified and real self-verified plastic surgeon practicing in Long Island and New York City. Here's how to tell if you're an ideal candidate for a mommy makeover. We'll be looking at videos of patients who are really interested in mommy makeover operations to see if they can achieve the ideal results. And we'll share what you really need to know if you're interested in having this operation. Let's get started. Well, mommy makeover is really a common terminology used nowadays for a bunch of surgeries. Basically, it covers from head to toe. It's not necessarily used just for mommies. It's for people who've lost excessive amount of weight, and even for some men who've lost a tremendous amount of weight, and they need some form of reformation and or rejuvenation of their body. It can involve basically tightening some of the skin in the arms, in the legs, in the thighs. When it comes to the breast, it can involve breast reduction, breast lift, or breast augmentation, or a combination thereof. And when it comes to the belly or tummy area, it can involve liposuction, tummy tuck, or the combination of the two. And when it comes to the lower extremities, it can involve thigh lifts or liposuction of the thighs and hips, Brazilian butt lift, and procedures of such. Let's watch some videos.
Hello, I'm Akia. I'm 38 years old. I reside in Maryland. The areas I am looking forward to have a mommy makeover are definitely a tummy tuck. I have back fat, my arms, and definitely a breast augmentation. They definitely need to be lifted for sure. And then definitely I would love to be able to have implants to just bring them up, because even beforehand, I was no more than a B cup. I would love to be like a nice uplifted D cup. Some of the questions that I definitely have is, as a mom of a 7 and 12-year-old who's extremely busy, how long is the recovery time? Will I need assistance, or how long will I need to actually plan out for that? I currently have scarrings, or previously. So how will that go as far as smoothing out previous scarrings and ones that I will have after taking this in? So with all of that said, in the areas that I really want to get fixed, my question is, am I a great candidate to have a mommy makeover, or what procedures do you think will best help these areas of mine?
Well, Akia seems to be a very pleasant and motivated patient. In terms of having had her children already, I think she checks that mark. It seems to me like she probably lost a lot of weight after her pregnancies. Starting from top to bottom, when you look at her arms, for example, there's a significant amount of excess skin hanging, almost like a flag. And in those conditions, liposuction alone is probably not going to help her. I think the best thing to do is what we call a brachioplasty, or tightening of the arms. It's usually done through a very concealed scar underneath the elbow all the way to the armpit. And it's a very safe operation, as long as she's realistic about accepting a scar there that might be somewhat obvious when she lifts her arm. That would be an ideal operation for her. That can be combined with some liposuction of the arm, but the main portion of it would be the brachioplasty, or arm tightening. When it comes to the breast, B cup breast can be easily enhanced to a C or D cup or larger. Many patients who simply undergo a breast augmentation surgery, they feel like that the breast also got lifted. In many cases, if the breast is so droopy that the breast augmentation alone is not adequate, we combine that with some form of breast lift through the same scars and the same incisions. When it comes to her belly and the back, it seems like she might have lost skin tone to the point that if we do liposuction alone, she may fit better in her clothing, but on the other hand, the skin may overhang in both areas of the front and back. The tummy tuck operation is designed to remove anywhere from the chest area down to the pubic area. Half of that skin is basically removed, or sometimes more than half of that skin. Any stretch marks that are included in the lower half of the belly is usually gone with the removed skin. Even some of the stretch marks above the belly button can be removed, and those that cannot be removed actually get concealed and get pushed down to the lower area, and most patients don't even mind it anymore. Akia was concerned about the downtime. Assuming she's a healthy person and does not have too many other underlying medical conditions, and she has some help at home, she could probably have most of those operations in combination at one time and recover at one time. I would say the recovery is probably limited to the recovery of the abdominoplasty part, which is 10 to 14 days.
Hello, my name is Eileen. I'm 56 years old from Los Angeles, California. I am interested in a mommy makeover. I have sagging breasts. I have a lot of loose skin around my abdomen and parts of my butt as well. So I'm interested in the full mommy makeover. I'm pretty fit and I don't have much fat, but the fat that I do have are in little areas that won't go away regardless of how much I work out. And I'd like to know if my options are only implants or if I can do something more natural. My goal is to get back to the way I was younger. I don't really necessarily need to be bigger. I just want to be as close to my original body as possible before having babies. I'm interested in knowing if it can be done all in one procedure, because I would like it to be one shot, just like the operation. And I'd like to know if I'm a good candidate for that.
Eileen seems to be very motivated and seems to be in great shape in terms of body mass index. Liposuction is usually considered for people who have some excess fat to be removed. Sometimes we get surprised, and even in a skinny person like her, liposuction can result in removing some fat, for example, from her flanks or belly, and we can re-inject that into her butt and enhance her buttocks. We can also consider just lifting the buttocks with some incisions and elevating her buttocks. In terms of the breasts, the ideal thing would be to put in breast implant, but if she's inclined not to have any types of implants, then a breast lift and some autologous fat injection. That means her own fat removed from one place into her breast may be a better option. In terms of the abdominal area, there's really not much fat to remove, even though we may do some liposuction of her flanks. But if she wants to get rid of those excess skin and stretch marks, then a tummy tuck would be a great operation, and it will bring her back to her ideal shape that she's looking to have. Assuming she's otherwise healthy and no major underlying medical problems, and she's not on any major medications, she's relatively young at 56, she could probably have most, if not all, those procedures done in combination at one time.
Hi, I'm Marianne Primo. I'm 38 years old and I live in Seattle, Washington. I'm interested in the mommy makeover because I would like a tummy tuck. I have a lot of excess belly fat. I'm also interested in back fat removal and a breast lift. I have 2 kids, so I've had 2 C-sections, and the trouble areas are just pretty bad. I have stretch marks on my stomach and also my breast. They are a little saggy. I do have some stretch marks in the upper area, so I think that I would like a breast lift. I'm a 38D right now. The questions I would have would be, how much would the full mommy makeover cost? And also if the fat can come back to the areas, how I have to do maintenance and keep eating healthy, keep exercising, or is this all going to come back? I want to know if I'm a good candidate for a mommy makeover.
Well, Marianne is 38, assuming she's not going to have more children. She is concerned about a few areas of her body, namely her breast, her back, her belly areas, with some excess fat and some hanging tissue and sagginess. Starting from the breast, she has 38 D-cup breasts. If she would only like a breast lift, she can have that done. It may bring her breast size maybe half a size smaller, because that's what the breast lift does. It basically tightens the breast and lifts the breast with very little tissue removed from it. If she would like further reduction of the breast size, then the breast lift operation, which is basically the same thing as breast reduction operation, can be done together as a breast reduction operation, and she could go down in size of her breast to whatever her other ideal breast size may be. In terms of the back fat, she can have liposuction of the back fat done in various ways of liposuction and have reasonable improvement of her back and flanks. In terms of the abdominal wall area, I can see that there's still a significant amount of fat and droopy skin left there. The ideal mommy makeover candidate would be one that has lost as much of the weight as they can on their own. We can help them remove some of the fat with liposuction and some of the hanging skin by tummy tuck operation. This doesn't mean that she cannot have the tummy tuck operation. She can, as long as she understands that she will not be absolutely flat-bellied. She will still have to work hard postoperatively after the operation to lose some of fat on her own and to get to the ideal shape that she would like to be. My recommendation would be that she loses as much weight as she can on her own before submitting to this big operation. Women who've had prior operations such as C-section or gallbladder operation or other abdominal surgeries, all of that can be done and removed and rectified and improved at the time of the abdominal plastic surgery. Marianne asked if the fat can come back after the liposuction. With liposuction or tummy tuck operations, we can in no way remove all the fat that's remaining in the skin. In fact, it's healthy and normal to have some fat left underneath the skin. That fat may still grow to a considerable size, especially if the postoperative regimen is not followed. We always recommend and instruct patients and help them with exercises and special diet after the operation so they don't gain the fat in the same areas and hopefully never again. But yes, if the exercise and diet are not regulated after the operation, some of that fat can come back. Finally, Marianne asked about the cost, which is a consideration and a concern for almost all patients who come for these operations. These operations, obviously, if they're combined, the cost will be lessened by combining the number of trips to the operating room. We make every effort to make them as affordable as we can for the patients, but the cost can be from $5,000 to $6,000 to several tens of thousands of dollars. Are you interested in Mommy Makeover? Find out all you need to know on this procedure on realself.com.